I'm called Edwin Lubanga Kende Brian. I'm 18 years old, from Uganda. I'd been diagnosed with TB that at the end it caused me tracheal stenosis, and I've been managed on nebulization from Uganda. After every 4 hours I have to be nebulized so that the trachea can be dilated, not to be so tight, just to keep the airway open. And this was discovered in March 9th, 2021. So I've been in the hospital full time, and I traveled to India on December 25th for further treatment. I came with a left lung collapse and really a narrow trachea, which needed stenting. As I came, they did a further checkup again, and what they confirmed from Uganda is still what they confirmed also here, that I needed stenting and the extraction of the left lung collapse, of which was successfully done by Dr. Pravid.
Patient Edwin referred to us from Uganda. He has a history of repeated admission due to shortness of breath. He was evaluated initially in his own country, which shows there is a diffuse narrowing of trachea in the region of carina and the complete obliteration of the left main bronchus. When he presented to us, we did a detailed evaluation which shows a diffuse narrowing of the trachea around 3 to 4 centimeter just above the carina, and the pinhole opening of the left main bronchus. On CD reconstruction of a 3D CT, we have seen that the left lung is completely destroyed with the complete obstruction of the left main bronchus and a narrowing of the lower of trachea. So this patient need the left pneumonectomy because of the destroyed lung, and the initial diagnosis was tuberculosis also, for which he has received a treatment in his own country. But before doing a pneumonectomy, we need to secure his airway, so we have planned for a tracheal stenting and dilatation of trachea, and after 2 weeks of dilatation we performed a left pneumonectomy, and he did very well after surgery. And on 4th to 5th week of post dilatation and tracheal stenting, we removed the tracheal stent, and patient did well and he was asymptomatic after this procedure.
And other team, which it went successfully. And the stenting, it was done by Dr. Shivanjo.
This young patient Edwin had presented to Artemis Hospital Gurgaon with the complaint of difficulty in breathing, and he had noisy breathing, so basically what we refer as stridor. He had a problem in his past where his lungs got damaged, and specifically his left lung was in a very bad state. So the main idea he had come to India was to manage his left lung. But when he first saw our colleague Dr. Praveen Yadav, who is a surgeon at our hospital, he felt that more than treating his left lung, the first we have to have a look what is the reason for him to have a noisy breathing. And the most important part which touched all of us doctors, when we spoke to his mother had a very clear idea that she would stay in India, whether we ask her to stay for 6 days, 6 weeks or 6 months, but she wants her child to go back in a healthy state. So we wanted to offer the best therapy to this kid. So what we did, we first did a bronchoscopy where we put in a camera through his windpipe to have a look what's going on inside. Once we had a look, we saw his windpipe had narrowed at a certain point, which we call as stenosis. That is the reason his air was not flowing properly. So what we did, we decided that we have to open his windpipe before we can plan anything else. Discussed with the family, went inside. We used a special technique called ballonoplasty, where we put in a balloon to open this constriction, and followed by we put in a stent there. A lot of people have heard about cardiac stents, but not many people know that we also have got airway stents, or what we call as tracheal stents. We put in a stent there, and the idea of having a stent there was that now this whatever we have opened would not fall back. The waiting period is around 6 to 8 weeks, where the windpipe will take its own shape, and then the plan was to remove the stent. During this time, Dr. Praveen got involved, and he handled his left side, and his left lung had to be removed, which we referred as pneumonectomy. So that procedure was also done uneventfully. After a period of 6 to 8 weeks, he came back to us. We did a repeat endoscopy, cleared the entire stent, and we removed the stent very peacefully. The procedure went uneventful, and today we have a patient who is absolutely free from this problem called tracheal stenosis. He has already undergone a surgery called pneumonectomy. He is healthy on one lung without any noisy breathing. He is able to engage in his physical activities. Whatever activity demands for him in his daily life, he'll be able to do it. So we feel so happy that today we are able to send him back from our country with a very positive vibe, that we have treated him holistically, not by just focusing on one part of it.
Which went so successfully. And from there, the stent had to stay in me for 6 weeks. And the days had already elapsed, and it has been taken out on Friday, the stent. And today I came for the review, on which they checked and they found out that everything is fine. I'm now normal. It was really a long journey. It was really a long journey for me and my mom. But finally we have come to the end. I want to really thank the team that worked on me. They really did a great job to give me a second chance in life.